Hey there, and welcome to the MediByte channel. I'm so glad you're tuning in. As a healthcare professional, I see firsthand that finding out you're expecting is usually one of the most exciting, yet totally overwhelming moments of your entire life. Suddenly, you're hyper-aware of literally every little twinge, ache, or wave of nausea. You might be sitting there wondering, wait, is this normal? Should I be calling my doctor right now? Well, I want you to take a nice, deep breath because you are in exactly the right place. In today's explainer, we're going to walk through a comprehensive introduction to symptoms during pregnancy. Our goal? To give you the ultimate triage and reassure roadmap for this incredible journey.
So here is our roadmap for today. We're going to cover normal changes in symptoms, when to call the doctor, understanding morning sickness, hyperemesis gravidarum, evaluating and treating nausea, and then we'll wrap up with our MediByte final takeaways.
All right, let's jump right into Section 1, Normal Changes and Symptoms. First off, it is completely normal to feel a bit confused by the absolute chaos of your changing body. But when we look at the broad spectrum of what's considered a normal mild symptom, you'll see that things like nausea, vomiting, or even random food aversions are entirely expected early on. You might find that foods you used to absolutely love suddenly taste awful, or maybe you've developed some intense, out-of-nowhere cravings. An increased sense of smell, breast swelling, fatigue, low back pain, and even some swelling in your feet and ankles. Yep, all of that is pretty much standard par for the course. So if you're feeling exhausted and your favorite morning coffee suddenly smells repulsive, you can rest easy knowing your body is just doing exactly what it's supposed to be doing right now. Moving right along to Section 2, when to call the doctor. We've covered the typical mild annoyances, but what if your symptoms aren't on that expected list? What if they're brand new, unusually severe, or they just won't go away? That is a really crucial pivot point, and it means it's time to identify the red flags that warrant actual medical attention. So here's the bottom line. If you experience any of these red light warning signs, you need to contact your doctor. Some of these, like vaginal bleeding, severe pelvic pain or cramps, and the leakage of fluid, which is often described as your water breaking, are actually perfectly normal signs of labor if you're full term. But if they happen earlier in pregnancy, they could point to a possible miscarriage or preterm labor. On top of that, symptoms like a fever, pain during urination, vision problems, persistent severe headaches, or severe swelling of your hands or face, those can indicate complications that only occur during pregnancy, like high blood pressure disorders. And this is super important. If you are past 24 weeks, any decreased movement of the fetus is a direct signal to reach out to your healthcare provider immediately. Let's shift gears a bit and look at Section 3, Understanding Morning Sickness. Now, even though everyone calls it morning sickness, let's be real, this nausea can hit you literally any time of the day or night. Chronologically, for most women, these symptoms kick in around week 5. They typically peak and are at their absolute worst around week 9. But hang in there, because here is the reassuring light at the end of the tunnel. For the vast majority of pregnancies, these symptoms completely disappear by week 16 to 18. The exact cause is still a little bit of a mystery, but it's very likely linked to the rapid increase of hormones like HCG and estrogen, plus progesterone slowing down your digestive system. That leads us nicely into Section 4, Hyperemesis gravidarum explained. So while typical morning sickness is basically a mild to moderate nuisance, there's an extreme end of the nausea spectrum that requires serious medical support. It's called hyperemesis gravidarum, and it's a severe, persistent form of pregnancy-related vomiting. We are not just talking about occasional nausea here. Women dealing with this condition vomit so frequently that they actually lose weight and become severely dehydrated. They simply can't consume enough food to give their body the necessary energy to function. And here's why that matters. When your body isn't getting enough energy from food, it sets off a chain reaction. It actually starts breaking down your fats for energy. This leads to something called ketosis. Ketosis is a buildup of waste products, known as ketones, which result directly from this fat breakdown. If you're experiencing ketosis, you might suffer from extreme fatigue, bad breath, and dizziness. Plus, the severe dehydration from constant vomiting completely upsets the balance of electrolytes in your blood, and you need those to keep your body functioning normally. Understanding your own personal threshold is absolutely key when you're deciding whether to seek medical help. Typical morning sickness means mild to moderate nausea. Sure, you might vomit occasionally, but you can keep some liquids down, and crucially, you aren't losing weight. In stark contrast to that, hyperemesis gravidarum involves severe, relentless vomiting where you just cannot keep fluids or food down at all. This leads directly to signs of dehydration. Think decreased urination, a racing heart, or feeling dizzy when you stand up, along with noticeable weight loss. Okay, Let's talk about solutions in Section 5, Evaluating and Treating Nausea. When you go in to get your symptoms evaluated, doctors essentially have to figure out one main thing first. Is this nausea obstetric, meaning it's directly related to the pregnancy itself, or is it non-obstetric? If it's pregnancy-related, like your standard morning sickness or hyperemesis, symptoms usually begin in the first trimester, they kind of come and go, and they aren't accompanied by abdominal pain. Doctors will use physical exams plus blood or urine tests to check for dehydration and those ketones we just talked about. However, if the vomiting starts suddenly, especially after the first trimester, and it comes with diarrhea, urinary pain, or severe abdominal cramps, that points to non-obstetric causes. We're talking things like gastroenteritis, a UTI, or maybe even appendicitis. In those cases, doctors will rely on urine cultures, stool samples, or even imaging like X-rays. So what exactly happens during one of these medical evaluations? Well, doctors are going to check your vital signs, things like your blood pressure and heart rate. They'll often use a handheld Doppler ultrasound to listen to the fetal heartbeat, which is always an amazing sound. Sometimes they'll do a pelvic ultrasound just to rule out rare conditions, like a molar pregnancy. And if you are vomiting frequently, they are definitely going to run urine tests to measure your ketone levels and blood tests to make sure your electrolytes aren't dangerously imbalanced. Which brings us to Section 6, Treatment Steps. I like to think of treating nausea kind of like walking up a staircase. Step 1 starts with simple diet changes for mild cases. This means eating 5 to 6 small meals a day, trying to eat before you even get hungry, and sticking to bland foods, like the brat diet, which is bananas, rice, applesauce, and toast. Literally just keeping some crackers by your bed to nibble on before you even sit up in the morning can be an absolute game changer. Step 2 involves alternative remedies. Things like ginger, acupuncture, motion sickness bands, and swapping to chewable children's vitamins can all really help. If those aren't cutting it, we move up the stairs to Step 3, which is prescription medications. Doctors will usually start with safe options like vitamin B6, and if needed, they might prescribe antiemetic drugs like doxylamine or ondansetron. Finally, Step 4 is reserved for severe cases, like hyperemesis gravidarum. If dehydration has really set in, you might need IV fluids directly into a vein to replenish your sugar, electrolytes, and vitamins. Sometimes that even requires a short hospital stay until you can safely keep fluids down by mouth again. And finally, let's wrap things up with our MediByte final takeaways. Wow, we have covered a lot of ground today, from the entirely normal physiological changes to the very clear warning signs that mean you need a doctor's immediate attention. Ultimately, your changing body is on an absolutely incredible journey right now. The biggest thing you can take away from this explainer is simply to listen to your body. Understand the difference between the mild, normal symptoms of a healthy pregnancy and those severe red light warning signs. Please, never hesitate to reach out to your doctor if something just feels wrong, or if your symptoms match the warning signs we went over today. Your peace of mind and your health are always the absolute top priorities. As you navigate all these changes, just ask yourself, are you truly listening to what your body is trying to tell you, or are you just trying to power through it? Thank you so much for joining me today. If you found this explainer helpful and reassuring, go ahead and hit that like button, share this with any expecting parents in your life, and be sure to subscribe to the MediByte channel for more clear, expert-driven health explainers. Take care of yourself, and we will see you next time.